Let's have a listen now to Dr. David Halpin, and he lives in the South West here. It's about 5 minutes long, but here it is. He's giving his I asked him to give us your diagnosis of Jeremy Hunt, because, of course, Jeremy Hunt for many years was the Health Secretary, and he's not too keen on Jeremy Hunt's record of what he did with the NHS during those years.
I'm David Halpin. I was an orthopaedic and trauma consultant at Torbay Hospital and at a wonderful orthopaedic hospital in Exeter, the Prince Elizabeth. I qualified in 1964, became a consultant, or a specialist, I prefer the title, in 1975. And I worked jolly hard. I cared greatly for the health service. I did have a private practice, but my job was in the NHS. And I've, in my retirement, spent thousands and thousands of hours defending it, and especially for the community hospitals in the system, which are vital. They've replaced it with what they call care at home, which is nothing like what the community hospitals were able to provide.
The next Prime Minister could be Jeremy Hunt. He was first at the Department of Culture, Media and Sport, then he moved on to the Department for Health. People I speak to say that he's done, it seems, quite a lot to damage morale in the health service. What was your diagnosis, Doctor?
On him, he was always denying the ill effects of their policies. He was often seen in wards, photo opportunities with ward sisters smiling. But I think he's a dishonest man, and I write a lot about the psychopath. And that is, I define a psychopath as someone who has an abnormal response to the loss or injury of others. That is, that they are cold people, and they don't, like I do, worry greatly about anyone being harmed, including in Iran, particularly at the moment.
When he came in, let's go back to the Department for Health. When he became Secretary of State for Health, he was having to implement something which had been brought in before by Andrew Lansley, the Health and Social Care Act. Can you just remind us what it was that Lansley invented and that Hunt was implementing? Well,
there were key changes. They had this model of provider and commissioning bodies. The commissioners were GPs, clinical commissioning groups, CCGs. If you ask members of the public what CCG means, the vast majority haven't even heard of it. But they're very powerful. They hold the budget, about 60% of the total NHS budget in any locality, and they decide what gets done. At the moment, in some areas, they won't do cataracts, for instance, but they're quite powerful. They are not conditioned. They're programmed to toe the line. So I spent a great deal of time trying with other people to save the hospitals in Ashburton, community hospitals, cottage hospitals as we call them, and in North Devon. I used to go and give talks. I've written acres of stuff. Not one word of my advice as a senior consultant of some reputation was taken on board by the CCG.
So what was the system before that these were replacing?
There was then, in fact, Tony, there were about 8 upheavals in the health service since I qualified. Every one has been injurious pretty well. It was called the Primary Care Trusts, I think, and there was a local bureaucracy. Bureaucracy has expanded. They say it's only about 1% of budget. I don't believe them. There's a vast bureaucracy. And the accountability has been reduced. Although they have lots of sham bodies like Health Watch that are meant to listen to people, it's a sham. And they've pushed onwards with a demanning and reducing beds. Thousands of beds have been cut. And the ordinary man and woman, the chances of getting good treatment in a hospital now are less than they were before.
Well, some would say, wouldn't they, that all these upheavals in the health service are actually deliberate. The idea is to make the way for private health companies. Is there any truth to that, do you think?
There is, no question. It's deliberate. You have to look at people's intentions. Mrs. Thatcher, who introduced the internal market against all the advice of the BMA and the Royal Colleges. She introduced it because she was, as an undergraduate, taken with Milton Friedman, the head of the Chicago boys, who were pushing the most vicious fund monetarism, capitalism really, with open talons from Chicago. And she had her own agency like Milton, to forget his name, a shrunken chap, and Hayek. She was also a student of his, or a liker of him, and they wanted to have a transactional system where people paid up front or by insurance, and that's what they've got virtually. People are now going private more in bigger numbers because they can't get treatment in the health service.
Now, Jeremy Hunt, who could be taking over as Prime Minister, he's did, I think, 6 years as the Health Secretary, but he does have some interesting family connections, doesn't he?
He has. Well, there's a website, a smaller website, which has looked at his family connections. First of all, he has his predecessors were on the East India Company, which is a rapacious, always given a romantic gloss, but it was a rapacious setup, quite extraordinary, really, and it took over lands, massive lands and peoples in the East with gunpowder and with wile. Interesting, Streynsham Hunt, I think is his full name. One of his predecessors was top of that. We can't blame him for that. But his cousin is Baroness Nettlestone, who was Bottomley. She was a Minister of Health, I forget when.
This is Virginia Bottomley. She was Minister of Health, I think, under John Major in the early 90s.
She's now chairman of Nuffield Health, or has been for some time. So you can see that. And there are other relatives who are admirals. I think Hunt's father was Admiral, and it's extraordinary how these people, these admirals, have got onto boards of hospitals. But I would not say their intentions are good. What I've done, Tony, is summarize in 3 words. It is destabilize. It's 3 Ds. 3 Ds. I like alliteration. Destabilize, demoralize, which they've done in spades, dismantle. That is the strategy, and it's being followed through to the nth degree. And I weep for the health service, I weep for the servants of it still, who can't speak up, they're frightened. Some of the doctors are lame, they don't speak up, and they never will do. In fact, the medical profession is rather pathetic on the whole on this.
What sort of Prime Minister do you think he would make?
I think he's got his own agenda. We'll see that the market will dominate even more. The cronies will do well, the corporations. He's backing the Remainers in a way now, but of course he may not get the votes now. But I noticed the BBC have been massaging him very strongly against Johnson.
Actually, I call him a doctor, which is rather rude, isn't it? He's actually a senior consultant, Dr. David Halpin. Martin is really describing. He says there destabilisation, demoralisation, and dismantlement of the health service.
I think the real problem, as Trump said when he came over here, he said first of all the NHS would definitely be part of any trade deal we're going to do with the Americans. Then, of course, he was told not to say that, and of course the back record of most of the Tory leadership candidates was that they've written pamphlets saying we should privatise the health service. So when they say trying to be Prime Minister, we didn't mean that. Well, it's pretty obvious that that's what you do mean. And of course, we've got the evidence of everything that you've done since you've had power, not since 1979.
Tony, we do sort of forget, don't we, that Jeremy Hunt was Defence Secretary, Health Secretary for, I think, I said there, 6 years or so. And the track record has not really been good, has it? I mean, particularly when we look at what's the situation at accident and emergencies, because so many people find it difficult to get doctor's appointments.
Mr. Hunt, again, comes from one of these backgrounds that we didn't know existed. But when I was little, people like that didn't exist. They were in fictitious books. The surgeon mentioned the East India Company. I don't know how far back into history he wants to go. I mean, long before the NHS was invented. But
well, he's saying Streynsham Hunt, apparently, some East India. But he also did say, to give him credit, he said, well, he can't blame him for that. But he comes from this kind of family line.
Well, that's, I'm going to sort of probably drop myself in it. Jeremy Hunt's father wasn't just an admiral. He was, I think, Admiral of the Fleet at one stage. Don't come any higher than that. He went again. Jeremy Hunt was at Charterhouse, I think, and educated there. And again, I'm concerned that they aren't really aware of what it is like to live in the streets. Now, I'm a Conservative councillor. I'm an ordinary person. I live in an ordinary house in an ordinary part of Bristol. There's nothing privileged about me in any way, shape or form, except that I've reached my age and I'm not ill yet.
So are you thinking, when you're having to vote between Boris or Jeremy, are you thinking to yourself, actually, I'd rather vote for Sajid and maybe I'll just abstain on this one, or what?
Well, the dilemma I have is that I am, here we go, roll on the drums, a Brexiteer. I voted for Brexit. I was the only one in my family, I think, that did, or the only one who's confessed to doing so. And I am being repeatedly criticised by the boss for doing so. And so my dilemma is, do I vote for Boris and try and force Brexit, or do I vote for somebody who is perhaps a little less of a convoluted person? When I say, because I'm convinced that Boris Johnson is from the same genetic makeup as Mr. Trump and Bill Clinton.
Yeah, maybe, yeah.
I mean, he has difficulty telling the truth. He has difficulty acting with propriety. I really think the guy is, as a human being, is not the greatest person going at all. But he is a guy who is leading the party on my desires. But I would hate to see him as a prime minister, because I think we would have the Ronald and Boris show. The press would have a field day on it.
Yeah,
Imagine.
It's a bit like the US presidency, isn't it? Where you look at the candidates and you think, well, almost you could pick an American citizen at random; they'd probably be a better candidate. Or maybe a tramp from the street, and they'd make a better candidate.
We've experienced the last few weeks these various hustlings. I think is probably the word. And Boris has been speaking, and they have all been speaking to the public. The public are not going to get a vote on this. And this is the thing. No one... people have asked me, can I count on your vote? And I've given them a response. But no one has actually come to me with the finer details. No one from any of these two parties now have come to me as a party member who will be allowed to vote and said the nitty-gritty, and this is what is winding me up a douche.
Yes, well, it's like we're being played, isn't it? You know.
Absolutely.
Anyway, Anne, the question for you, I mean, because obviously you're not going to be voting, but the big question, I think, for many people's minds will be, and the question with Jeremy Hunt and Health there, is about privatisation, about slow privatisation. So where does the Brexit Party, and if you haven't got an answer for that, where do you stand on this whole thing of NHS privatisation?
Well, I think there are some things which are so big they need to be delivered by the state. And you look at things like the NHS, and that is clearly one of them. What I sensed from listening to your interview there with David Halpin was his complete frustration with nobody listening to him. So he was there saying about all the advice he'd given and everything else all the advice he'd given, all his expertise in his profession, and nobody was listening to him, and nobody's paying attention to him. And I think this is the state we are in the country in so many different ways, whether you're talking about the NHS, whether you're talking about the armed forces, whether you're talking about the police, the professionals on the ground, and particularly, teachers as well. But these professions are just not being listened to. And I think this is a real crisis that we have here. And I haven't heard, as you were saying there very well, Tony, I haven't heard either Johnson or Jeremy Hunt actually answer this question of, are they actually listening to the public? And I like Javid. I thought he was a good candidate.
Anyway, we're joined on the line, I hope now, by Tim Gopsill. Hi, Tim, are you there?
Yep.
Tim, you, I know, have written quite a lot about Jeremy Hunt and his time at the Department for Culture, Media and Sport, which he was in before being Health Secretary. What was his track record like?
It was his first ministerial job after they won the election in 2010.
and he was Culture, Media and Sports Secretary, and it fell into his lap an opportunity to demonstrate exactly where Jeremy Hunt's preferences were. What happened was this. Rupert Murdoch, a name that people may know, who was the owner of a whole chain of newspapers and of a proportion of Sky Television, put in a bid to buy the whole of Sky Television. The bid went for consideration by government actually to the Department of Business. At that time, the secretary there was the Liberal Democrat Vince Cable, who had a more liberal attitude, and he regarded examining this takeover as a challenge, and he said so, unfortunately, to some undercover journalists, and he got caught out. He, in a sting by the Daily Telegraph, was sacked from considering the case, and it passed to Hunt. Now, Jeremy Hunt proved to be completely, can I say corrupt on air? He had a very
well, it's okay, we just called him a liar. Actually, no, it was Boris we were talking about as a liar, not Jeremy.
The truth, and what happened was he was found to have had very, very close relationship with the PRs for Sky Television and the Murdoch Press. For the News Corporation, which was Rupert Murdoch's company, they had a head PR in London whose name was Fred Michel, and it later came out that they had very close buddy-buddy relations, and that Jeremy Hunt did everything he could to help Rupert Murdoch make the acquisition, and indeed it would have gone through. In June, July 2011, it's that long ago, if it hadn't suddenly been exposed in the press that the Murdoch newspapers had been tapping people's phones, bribing officials and all the rest of it, and a complete scandal blew up in which led to, people might remember, the Leveson inquiry. And in the Leveson inquiry, which was into corruption in the press, which was probably, I think, the most searching inquiry into corruption in the British ruling classes that there's ever been, ever. It was revealed, the documents came out proving this corrupt relationship that Jeremy Hunt had with the company. And if it hadn't been for that scandal breaking, Rupert Murdoch would have got his hands on Sky Television and consolidated his monopoly on the British press. People might know that a couple of years ago he tried again, and this time he was bought out by other companies, and it's all over. But that was a great relief, but no thanks to Jeremy Hunt, who did everything he could to try and get the biggest media owner in Britain already to control yet more of it.
Well, but Sky now is owned by Comcast, which is a US company controlling Sky News. I mean, surely that's even worse, isn't it?
Well, no, nothing like, because they don't own any newspapers in Britain. They don't have anything like such control on public information and national political affairs as the Murdoch media did. They controlled the biggest newspapers, the biggest share of the press they've had for years, and if they completely controlled Sky Television at a time when the BBC's in decline and Sky was so awash with money, Sky makes unbelievable. Do you know Sky has more than double the income that the BBC does every year, and it spends hardly any money at all on programme making, but the power that it has is increasing all the time. So that was a bit of a let-off, really. But listen, if I can say, Tony, when I just was listening to this programme, you were talking about the NHS. Now, Hunt moved on from that job into being Health Secretary. While he was Health Secretary, he didn't just increase the process of privatisation with people like Virgin Group buying health facilities, but he started this dispute with the junior doctors, with the hospital doctors, the most damaging and prolonged industrial dispute that's ever been in history, trying to stop junior doctors getting their fair hours, fair pay, and all the rest of it.
Well, just hang on a minute. That's a big claim, the biggest dispute in history. Compare it to something like the miners' strike.
Well, no. In NHS history, Tony, in NHS history, because it went off for so long. There's been problems with nurses and people over the years, but to actually goad hospital doctors who are pretty, these people work 60-hour weeks, who are the most dedicated people that the health service absolutely depends. To goad people like that with all their commitment to public service into strike action took some doing, and Jeremy Hunt did it.
What about more recently on Iran? Because this is it almost looks as if we're staring another kind of Iraq type situation in the face. And of course, Hunt now is Foreign Secretary. What's his track record been there?
We might well be. You know, I think this put this context to what's happening currently. Jeremy Hunt to commend himself to that rump of the population who are members of the Conservative Party, not Boris Johnson. That's who he is. He is not Boris Johnson. And Boris Johnson is supposed to be a wild and wacky and uncontrollable person, and Jeremy Hunt is supposed to be Mr. Sensible, Mr. Reliable, safe pair of hands, and all the rest of it. Well, let's look at him as Foreign Secretary. At the moment, it does appear that the Americans, whether they want to go through with it or not, are trying to provoke some kind of military confrontation with Iran. Now, in Britain, we have the problem with Iran of Nazanin Zaghari Ratcliffe, the wife of the Richard Ratcliffe, you know, the nice guy, the nice couple, who's being held hostage, basically, by the Iranian government. She's been held in jail by the Iranians on trumped-up charges of espionage, when what they want is Britain to settle a long-standing, big dollar debt. And Hunt, like everybody else, agrees that Boris Johnson, yes, he messed it up when he was Foreign Secretary by saying stupid things to Parliament, to a parliamentary committee, and Jeremy Hunt has put himself across as he's listening, he's the sympathetic man. Well, now he is running with the Americans more than any other European leader. He's going with the Americans, backing their threats to Iran. What's that going to do for Nazanin Zaghari Ratcliffe, one asks?
Finally, what about Julian Assange? We haven't heard a lot about that recently, and not necessarily with reference to Jeremy Hunt or Boris Johnson. But, I mean, this where do you stand on that, Tim? I wonder, because there are a lot of criticism of Assange over the years, and now it looks as if he might be extradited to the US.
That Britain has signed acknowledgement of receipt of the extradition request this week, actually, and it's going to go to the judges. I don't necessarily think it'll happen, because in the past the judges have supported people who are resisting extradition on grounds of freedom of speech, which is something, by the way, that Jeremy Hunt makes a big deal out of supporting. Just to come back, if I may, for a moment to Jeremy Hunt, in 2 weeks' time, Britain is hosting a world conference, which is very much being heavily promoted, of press freedom. And there are media bosses and people coming from all over the world. And Jeremy Hunt, at the height of the Tory party election, is going to be presenting himself on television everywhere as Mr. Free Speech and all the rest of it, despite the damage that, you know, big media companies are doing. But as far as Iran is concerned, he is not going to advance any kind of peace or justice in the Middle East.
OK, Tim Gopsill from London, thanks very much for joining us.
No worries.
I don't know what you make of that. Maybe you first, Tony Carey. His record at the DCMS not particularly good, particularly with the Murdochs, getting in bed with them effectively and with their PR people. But also, we've heard a similar thing from David Halpin at the Department for Health. With Baroness Nettlestone, otherwise known as Virginia Bottomley, in his cousin, and also she is now. She was a former health secretary in the John Major days. She's now chairing something called Nuffield Health, private health. So he's very close to the people that want to privatise the media, or certainly to get hold of it and to get it into their hands, and the same in the whole.
Well, I think
service.
By being in that family position, they should exclude themselves. If I'm in my role as a counsellor, I'm not allowed in any way, shape or form to promote the antics or the businesses of family or friends. I have to be totally impartial, and I don't think that is happening here.
I think it's interesting, isn't it, also, that the national press haven't really picked up much on these family connections of Hunt. I mean, if his cousin is chairing Nuffield Health, I think we should know about it.
I think we possibly would do. We still have weeks to go before the vote. It's a great pity that more people didn't see this coming and join the Conservative Party in the last year or so, because it must have been, the writing must have been on the wall, so that more of the general public could perhaps have a say. I'm, as you can gather, I'm disillusioned by the way this party's going, and I really feel
so are the voters, apparently. Anyway, look, a final question to all three of you. Maybe you first, Anne. Do you think we'll be out on the 31st of October of the European Union or not? And why? Why do you give that answer?
Well, I was just listening to that interview and reflecting on it, and the thought that came to me is if Jeremy Hunt can't negotiate with junior doctors, how on earth is he going to negotiate with the EU? So I have absolutely no confidence that Jeremy Hunt is going to be successful in going back to Brussels.
There is something farcical about his claim that he's going to get a deal from the European Union. I think everybody must look at that and say, well, you're not, actually. Yeah,
I was trying to be polite, but no, they're absolutely right. And with Boris, I just don't trust him because he flip-flops. He talks about... He said that Mrs May's deal was a disaster and he didn't vote for it twice, and then the third time he did when he came under party pressure. I just don't trust the guy.
OK, so are we going to be out or not on the 31st?
My money would be on that we're not.
The best I can give you is I don't know.
Martin?
Then we're probably not, but of course, I mean, even if we were out, it wouldn't be the end of it. It's going to go on and on and on. But we're going to be in the care home, a lot of us, before it's all sorted.
Why is that?
Well, because there's so many things to resolve. Even if, for example, the Remain get what they want and we don't leave at all, there's still going to be recriminations about that. And if we leave on, and of course, one of the real days, I'm quite blasé about this, because if there is a no deal Brexit, then there's going to be a run on the pound, crash in the housing market, and then we'll have a general election on the back of that, on the first past the post. We'll see what happens with then. Bloody noses.
Well, I'll tell you what, I'll have a little look at William Hill and see what they're saying on this one. Anyway, we've got a big event next Wednesday here in Bristol, and it's the rollout by Vodafone of 5G. That is this fifth generation mobile phone data network, which is the highest frequencies ever, the highest power ever, and the shortest range ever. So lots and lots of these masts going in, I would imagine, right now here.